All right, so I'm at a public appearance for Sister Pat in Enfield raising money for the adult daycare program she and the sisters run up there when a man comes up to me and says, "My bald spot used to be as big as yours." And I'm like, well, that's very nice. He goes, and then he shows me his new hair. It wasn't a wig and it wasn't plugs. It was his own hair growing in like the rest of his hair. So I said, who did that? How did they do it? How much? And he told me a doctor right in Enfield performed this fairly new procedure. So I went to check it out.
Bud Devlin had a little problem. Not a big one, just a little one, but big enough to try and fix it. Bud was developing a bald spot.
What was going on back there?
I was getting a bald spot.
Getting a bald spot, and your wife said, get it fixed or you're out.
Yes.
She was the one who made the appointment.
She actually did.
Yes, Bud's wife made an appointment with their regular doctor, Dr. Shah, an internist who just started working with an experimental hair replacement procedure. It's called PRP, platelet-rich plasma.
Use of PRP for aesthetics is relatively new. It's started maybe about 10 years ago. And this hair regrowth, it's more commonly done in other part of the world. US, it's still not picking up that much. It's relatively new here.
PRP, it's a fairly simple technique, and one look at Bud's before and after shots, it looks really effective. That's all new hair you're looking at on top of Bud's head.
All this area was a bald spot, and after that, all this is a new hair which you're seeing.
That's pretty good.
Yes.
That long hair.
This long hair is all his new hair.
Now what about, like, we're here?
He's going to still, if you see it, there is hair follicles and hair growing. This area was done the last, and that area is only 2 weeks, and you can see hair there already.
And how long does it take before you see the full result?
Usually you would see some hair growth within 25 to 30 days, but to see maximum effect, you would have to wait about 3 to 6 months.
Would you recommend this?
Yes, I would.
Because hair is important.
Without hesitation, yes. I'm vain, I guess.
We're all vain. We all want to have hair, right?
Yes.
So what do you think? Should I do it?
Yes.
All right, get the blood thing going.
If it can grow hair on Bud's head, why not on mine? So we begin. Dr. Shah starts by drawing blood. He's after the very important platelets.
Platelets are important because they not only help, which everybody knows is about clotting. If there is any cut or anything, it helps for the blood to be clotted and stop the bleeding.
Okay.
But also, it also has many growth factors.
So these platelets are like magic.
They contain magic. They are not magic.
Through lab experiments, researchers found that these platelets,
They found out that they are attracting all kind of mesenchymal stem cells and also stem cells which would produce hair follicles. So through that studies, they found out that they might be able to help it.
so out of my pint or so of blood, Dr. Shah has to get the 6 to 10% of it that's platelets. And this is where the machine comes in.
We spin it down with the harvest machine.
The blood is separated into 3 parts.
This is the 3 layers, as I told you. This is platelet poor plasma. That white line, what you see, is concentrated platelets, and this is rest of the plasma.
Dr. Shah will be using the center portion and the bottom portion.
Then you take the platelets and inject them into the head?
Yes, we take that out and inject it to 1 inch space between each injections, and we inject into the scalp or the area where we need to get hair regrowth.
Okay, so Dr. Shah's joining in just a little bit. We're going to see the actual procedure coming up. It's not a pretty sight, but we're going to show it anyway. Dr. Shah, you've been kind enough to come into the studio. We appreciate that. Thank you so much.
Thank you very much.
You're a nice guy, too, which makes the pain a little bit better. All right, just a couple of questions. Why isn't everybody doing this? Because we're seeing the results that I saw from your 5 or 6 patients are pretty incredible.
Yes, the people are starting to do it. As I told you, about only 10 years ago, they started using PRP for aesthetics.
Okay.
They've been using it in dental procedures, and some podiatrists have been using to heal plantar fasciitis and other stuff, but recently they have started using for aesthetic purposes.
And they're using it in other parts of the world?
They are using a lot, and for a longer time, in Italy, Spain, Brazil. They've been using it for a long, long time.
So that explains why the Italians are so hairy.
That's right.
No,
Maybe.
I'm just kidding. Is the procedure approved by the FDA?
The PRP itself has been approved for other things, but for hair regrowth, it is still not approved for it. But it is still legal to use it because it's been a lot of people are using it, and there is no restriction to it.
So there's no black market on PRP, and we're not doing something illegal?
No, it's not a black market.
Okay, side effects?
The most common side effect is the injection sites. When I'm injecting, that is little painful. I wouldn't say a lot pain. you experienced it. Maybe depends on what the pain tolerance is, but obviously not much pain there. And the other reactions would be to see any kind of inflammation within and some bruising, which goes away in about 4 to 6 hours.
4 to 6 hours, and I was surprised because it looked so bad coming out of your office. I took a shower that night, my hair looked normal. So your father, you did it on your father.
Yes, I did it on my father.
I'm thinking if you did it on your own family member, he's safe enough for me.
Absolutely.
So coming up, we're going to see the procedure itself, but I have to go back for 2 more treatments.
That's right.
4 to 6 weeks apart.
I would do about 4 to 6 weeks apart.
And then 75% of the people
have good results.
So we're going to wait and see. I know you have to get off to India, so we're going to let you go. And I know your mother's not feeling too well, so we wish you the best of luck and good health.
Thank you.
Travel safely, and that story's coming up in just a bit.
Okay,
Kara?
thank you.
Nice to see you.
It's incredible. I can't wait to see the procedure. All right, so coming up, recipe of the week.